Welcome back, everyone. Next up, we have NovaBay Pharmaceuticals. It trades on the New York Stock Exchange American under the symbol NBY. And NovaBay Pharmaceuticals develops and sells highly effective and scientifically proven products for the large growing eye care, skin care, and wound care markets. The company's leading eye care product, Avenova, is the most prescribed antimicrobial lid and lash spray and is clinically proven as an effective solution to relieve chronic eye conditions, including dry eye. So let's welcome the Chief Executive Officer, Justin Hall, to the Emerging Growth Conference. Nice to see you, Justin.
Yeah, nice to see you too, and thanks for having me.
All right, we look forward to hearing your presentation, and call me back when you're ready for questions.
Sure, absolutely. So I'll just jump into it. The way that I like to describe NovaBay, for those who are unfamiliar with our company, is that NovaBay is the parent company for three different verticals. So we have Avenova for eye care, we have DermaDoctor for skin care, and we have NutriPhase and Phase One for wound care. So we have three different verticals dominated by three different brands, all under the parent company of NovaBay, which, as you mentioned, is a publicly traded company on the New York Stock Exchange American. So in sort of understanding just how the business is set up, Avenova is our hero SKU. It's where the majority of our revenue comes from. This is a product that we created in R&D, put through clinical, got the FDA clearance, and then started selling directly to eye care professionals, both optometrists and ophthalmologists, as an RX-only product. In 2019, we created an over-the-counter version that can be purchased without a prescription, and we sell that directly to consumers on Amazon and on our own website. The second vertical we have is skincare. So we acquired DermaDoctor in November of 2021, and it is an OTC brand that sells directly to the consumer, but all created by a licensed dermatologist. So this is not cosmetics or colors. They are all problem-solving products. So the hero SKU there is KP Duty, which is a scrub and a lotion for keratosis pilaris. It's those annoying bumps that a lot of people will get on their upper arm. So we have 30 different SKUs, but they're all targeted towards solving some sort of problem, but they are all fragrance-free and dye-free. And then our third vertical is NutriPhase and Phase One, and that leverages the same hypochlorous acid technology that we have for Avenova. It is a higher concentration and is focused for the wound care market. So we have distributors that sell this RX product here in the United States and also in China. The investment highlights. So just moving away from the products a little bit and talking about our numbers. So when we acquired DermaDoctor in 2021, that means in 2022, we had a banner year. We had revenues of $14.4 million. That was up 40% from the year before. And then also on the expense side, we were able to bring in all of that extra revenue, but actually decrease our sales and marketing expenses. So the overall strategy last year was to increase sales and lower our sales and marketing costs, both of which we were able to do. We were able to do so through our strategic execution. So looking at Avenova, already well known with optometrists and ophthalmologists, but there is a new demographic out there who really needs Avenova. Avenova is an antimicrobial lid and lash spray. So those long eyelashes that are very, very popular right now, those people need Avenova more than anything. But a lot of them are not familiar with what good lid and lash hygiene really entails. And so we are expanding into a totally new customer demographic with our over-the-counter direct-to-consumer product. And that's where I think a lot of our growth in the future will come from. But our growth will also come from new product launches. So Avenova is very commonly prescribed by doctors for dry eye. And along with dry eye comes good lid and lash hygiene, warm eye compresses, and also, very importantly, an oral supplement. So we just launched earlier this year an Avenova oral supplement that has high omega-3s and antioxidants from the maqui berry. So it's a distinguished product coming in to really be a companion product for the antimicrobial Avenova spray. And having customers buy both of those products, first in class, directly from us. We also partnered with Iganics to start selling the first FDA-approved totally organic eye drop. So for those that are sensitive to preservatives and want a totally organic sterile eye drop, we now have that through Iganics. DermaDoctor also, we have put out some new products, the Calm, Cool, and Corrected. And then also the most recent launch is the Comfort and Joy psoriasis product. So that was launched exclusively on QVC last month and will continue to be exclusive on QVC for the next 2 months before we start selling it through our own channels. So we have a customer demographic expansion. We have expansion through new product launches. And then we also have geographic expansion opportunities, expanding into China and into the EU with the DermaDoctor product. So what DermaDoctor has done is created global formulations that can be sold anywhere in the world, not just in the United States, but in the EU and in the Middle East, all with one very efficient formulation. Just a few things that we have done recently that are worth mentioning. So while Avenova is the majority of our revenue, DermaDoctor has growth and expansion opportunities, but our wound care division also doing very well. In May, we fulfilled a $1 million order for NutriPhase from our Chinese distribution partner. And we manufactured and fulfilled that in the month of May. So we will see that revenue reflected in our Q2 results. And as I mentioned, we had some products launched on QVC, and that is the Calm, Cool, and Corrected eczema treatment, and then also the Comfort and Joy psoriasis cream. So diving in a little bit more to Avenova, so everybody has a good understanding of what our hero product really is and what it does. So I like to explain it in a very simple way. So if you think of Clorox bleach, or if you think of hydrogen peroxide, isopropyl alcohol, and you think about the antimicrobial effect those solutions have. Now imagine if any one of those solutions was produced by your body, 100% non-toxic and non-sensitizing, meaning it doesn't sting when you put it on a cut, a scrape, or just intact skin. When applied, it just feels like water, right? So that's why we call hypochlorous acid the magic molecule, because it has that very, very strong antimicrobial effect. But the magic of it is it's completely non-toxic, non-sensitizing. You can use it as much as you want. So that's sort of the science and the magic behind hypochlorous acid. And because the eyelid is the thinnest skin on your entire body, a very pure form of hypochlorous acid is the perfect way to really clean those lids and lashes and remove the overpopulation of bacteria that is the cause of so many eye frustrations, so many common eye frustrations like dry eye, blepharitis, styes, chalasia, contact lens discomfort. All of those things have a root cause in an overpopulation of bacteria on the lids and lashes. Just as we brush our teeth in the morning and in the evening for good dental hygiene, it's really important, especially as we get older, to have good lid and lash hygiene. We all wake up with kind of gunk around our eyes, and sometimes just a little bit of soap and water isn't enough to get rid of that. You need something that is antimicrobial, and you really need to pay attention to removing that excess bacteria to keep your eyes healthy. So we were the very first to launch hypochlorous acid into the eye care market. Prior to us launching Avenova, nobody had ever thought of using hypochlorous acid in the eye care space. Since then, we've had a number of competitors come into the market, but I am happy to report that not a single one has a similar formulation or is as effective or as pure. So when we are looking at the competitive space, it's very important to realize that Avenova is the premium product in the market, and it is also, it was the very first product to market. So a lot of copycats, but nobody is even close to becoming equal. So we sell Avenova in a number of different ways. So as I mentioned, it was originally an RX-only product, so you had to go to an optometrist or ophthalmologist. They would write that prescription for you, and then you would take it to a retail pharmacy and then have that filled. They would run your insurance and do that whole process. So we still do have that particular channel, but what we did was we wanted to open it up because so many people can benefit from lid and lash hygiene. Old people, young people, dry eye, as I mentioned, styes, chalasia, just a whole number of common eye frustrations. And so we wanted to make it as easy as possible for as many people to use Avenova. So we created the physician dispense and over-the-counter channel. So physician dispense just means that doctors buy from us wholesale and then resell out of their offices. And then OTC is obviously where we move the highest number of units, because once somebody gets prescribed Avenova from their doctor, what they can do is on their second or third or fourth bottle, they can go either to our own website or onto Amazon just to have it shipped directly to their house, no prescription required. And just the opportunities for growth. So while we do have those three sales channels, the retail pharmacy channel seems to chug along, but with a limited amount of growth, just because it's the hardest for patients to go back and ask for a refill on their prescriptions and then go to a pharmacy. The physician dispense is very good, but a lot of doctors don't want to deal with inventory and sort of charge patients. And so just our number one way of getting the product into the hands of patients is just the over-the-counter version of the product that's sold directly to the consumer. So to support that sales channel and chase down that largest opportunity we have for growth with Avenova, we have come up with a very robust direct-to-consumer sales channel. And so that includes social, paid search, and different educational campaigns, really to teach people about the importance of lid and lash hygiene. A lot of people don't understand how important it is, but once they start doing it, the results are phenomenal and they become customers for life. So we do also have a complete portfolio of dry eye products, all to complement the Avenova antimicrobial spray. So we have drops for immediate relief, which are commonly referred to as artificial tears, a warm eye compress in case any of those glands are blocked. They need to be warmed up and then cleaned with the antimicrobial cleanser. And then also wiped away. That mechanical debridement of removing the scurf from the lids and lashes is really important for a clinical outcome. And then, as I mentioned, supplements. So almost every doctor and every blog that you read will tell you omega-3s are really important for eye health. And so we have an Avenova eye supplement that has both antioxidants and a very high concentration of omega-3s for eye health. As I mentioned before, this is a new customer demographic for growth. A lot of fake eyelashes out there right now, and those are magnets for dirt and bacteria. And so if anybody is wearing those artificial extensions, it's really important to practice good lid and lash hygiene, and Avenova is a huge part of that. Just washing them is not good enough to keep them clean and your eyes healthy. Let's switch gears a little bit and we can talk about DermaDoctor in our skincare vertical. So our skincare vertical is really dominated by the DermaDoctor brand. So the DermaDoctor brand been around for 20 years, just recently acquired by NovaBay in November of 2021, but very well known for the past 20 years. It has been on TV, on talk shows, in magazines, featured in blogs, and won several awards. But when we think about the DermaDoctor family, especially from an investor perspective, you kind of think, well, what really matters? And the majority of the revenue is really focused around 4 product families. So the first one is the Kakadu C. So Kakadu C is a plum that is found in Australia, and it has the highest concentration of vitamin C found anywhere. It's like 100 times the vitamin C of a Florida orange. So what you're getting with Kakadu C is a vitamin C serum that has a very, very high concentration of vitamin C, which makes it more effective than other products on the market. I mentioned KP Duty earlier. KP Duty stands for keratosis pilaris, and is those bumps that are very hard to get rid of on the upper arms or really anywhere on the body. So there's a lotion and a scrub that go there. And that is one of the first products that DermaDoctor had a lot of success with, and they have a cult following to this day. Ain't Misbehavin' is the acne line, and then Calm, Cool, and Corrected is for eczema. So out of all of the products and the families that we have, there are really 3 sales channels. So those are, the direct to consumer, and that is on dermadoctor.com and on Amazon. And then domestic retailers. So sold at Costco, on QVC, Macy's, Target. So you'll find DermaDoctor products at all of those retailers, and then international distribution. So we have good distribution in the Middle East right now and Great Britain, but also chasing down opportunities and growing our business in China. So China is a huge opportunity for us, and we have recently brought on some new consultants to really help us drive business in China, and then also onboarding a European distributor. And so just a little bit about China. As everybody knows, it's a huge market, but you really need the right people on the inside telling you how to sell in China. And so just at the end of 2022, we brought on and onboarded those consultants who are helping us navigate both Tmall and TikTok over there in China, and we are already starting to see the positive results of those relationships in that market. Again, switching gears over to wound care, totally different market from this OTC DTC side of the business. But when I was talking about Avenova, I was trying to explain how powerful it is as an antimicrobial, but it's completely non-toxic and non-sensitizing. Well, we have those things with Phase 1 and NutriPhase. So this is our special proprietary and patented formulation of hypochlorous acid, very powerful antimicrobial, but used in the wound care space for those wounds that are very hard to heal or are antibiotic resistant. So these are wound washes that remove bacteria, kill bacteria, remove those toxins, and help those difficult wounds heal more quickly. So kind of wrapping up here, just moving a little bit away from the product side and then back to the financial side. In 2022, really what we did was, our major accomplishment was diversify away from just eye care and just Avenova by bringing in the DermaDoctor brand. By doing that, we increased revenue 41% and had net product sales of $14.4 million last year for fiscal year 22. And also the big win was we were able to increase our revenue by 41%, but we were actually able to decrease, just through better ad efficiencies, sales and marketing expenses over the prior year, and ended last year with $5.4 million in cash. So now that we're already well into 2023, just a quick recap to get everybody up to speed. For our Q1, which we filed not too long ago, consisted of net product revenue of $2.2 million from Avenova, $0.8 million from DermaDoctor skincare products, and $100,000 of Phase 1 wound care products. But also remember, the wound care revenue tends to be a little bit lumpy, and we will have $1 million of revenue in Q2 from the NutriPhase wound care product, and then ended the quarter with $3.7 million in cash. And this is our last slide. So sort of just to wrap up, driving future success from a solid base of recognized products, established brands that have reoccurring revenue in the three verticals: eye care, skin care, and wound care. And a multi-pronged strategy where we are not only going after those sort of clinically tested problem-solving products in a direct-to-consumer marketplace, but also pushing strong on that doctor-recommended halo effect that we have for both the skin care, eye care, and wound care verticals. And then, of course, in this economic environment, expense management like we did last year, trying to run the business, grow revenue, while being very, very conscious about sales and marketing and G&A expenses. So that kind of wraps it up, but would love to take any questions that anybody has.
Great job, Justin. Yes, we do have some questions. Like we talked about before we started this, I'm really curious about Avenova and how it differs from other prescriptions and OTC products for dry eye specifically, because I want to relay this message to my mother who suffers from it, and it's just horrible.
Yeah, so that's a really great question, and it can be very confusing for people who have dry eye because there are so many different treatments. The market is huge, and a lot of companies come into it from different angles with different products that all work in different ways. So the nice thing about Avenova is it has no contraindications with any other eye care medication. So you can wear it with contact lenses. You can wear it, you can use it when your doctor has prescribed cyclosporine, which is like Restasis or Xiidra, Liftigras. There's all sorts of prescription products out there that are designed to stimulate the glands to produce that tear film, right? But none of those things are going to work if you have an overpopulation of bacteria on your lids and lashes and those glands are blocked, right? So what Avenova does is it cleans the lids and lashes. It makes it clear. Those glands can then produce the tear film over the ocular surface that your eye needs to be healthy, right? So you can use it with all of the prescription stuff. You can use it with your artificial tears, and it just ensures that your eyes are as clean as they can be, and those other medications work as well as possible.
And talk about the market opportunity for dry eye and what trends are driving growth.
So there have been a lot of it's a huge market and it's growing, right? So there's a lot of people talking about dry eye, more so today than ever. A side effect of the pandemic was screen time, right? So everybody was on Zoom calls and kids were staring at screens, and that's a hard thing to get away from. And one cause of dry eye is just not blinking enough and not keeping your eyes sort of healthy. So we are seeing more dry eye now than ever. And the market is huge. There's, I think I read a statistic recently that 59 million Americans complain about dry eye. So the market is huge. And I firmly believe every single one of those people, whether they're on prescription medications or not, can benefit from better lid and lash hygiene, keeping those eyelids clean so you can be, as good as you possibly can be in your healthy state.
Now you have the OTC version that you can get on Amazon, like you mentioned, but also the prescription version. So talk about your prescription version, how you created a doctor-recommended consumer brand.
Yeah, so that is really the crux of our brand, and I'm glad that you asked about that. So first, I'll say our OTC version of Avenova is exactly the same as the prescription version. But the halo effect of being a doctor-recommended brand is really important in instilling confidence in that sort of OTC version. Most people don't understand what lid and lash hygiene is and why it's important. But if you go to your doctor and your doctor says you know what you need to do? You need to improve your lid and lash hygiene and make sure your eyes are clean and healthy before we do any expensive or fancy, RX drugs, right? And so when people hear it from their doctor first and it's explained to them why it's important by their doctor, they're more likely to try the product, to use the product, to stick with it, and then just become believers in the product. And, like me, I brush my teeth every day and then I take out my Avenoma and I clean my eyelids.
Wonderful. Talk a little bit about some of your best-selling products in the DermaDoctor brand and their advantages.
Yeah, so I tried to touch on that a little bit in the presentation, but really there are two truly differentiated products, and that one of them is the Kakadu C, and that's the big seller at Costco and a big revenue driver. There are a lot of vitamin C serum products on the market, very popular to sort of lighten blemishes on your skin. We're just coming up on summer, and a lot of times after summer, people have spent time out on the beach, out on the boat, and they realize, oh, I have some sun damage, and I would like to lighten up, some of that sun damage that I got over the summer. So we do see some seasonality, and that this product becomes very popular in the fall when people are using it, and that's when you'll see it at Costco, we use and we move the greatest amount of volume, but it's a differentiated product. So as I mentioned, we use the Kakadu C plum from Australia, and it is the highest concentration of vitamin C of any fruit. So what you're getting is a very, very high potency vitamin C for a really great price at Costco. So that is one really differentiated product. And then the other is, what we'll call the hero SKU, KP Duty. So that keratosis pilaris. So if you're wearing a shirt just like the one that you're wearing right now, and you have sort of those irritating bumps on your arm, it is designed to help smooth and reduce those. And it's a very difficult thing to do. It's not just something that, you can cover up very easily or it goes away overnight. But our two products, the scrub and the lotion, are two of the most effective products for that, and really well known out in the marketplace for being the most effective products for that particular condition.
Wonderful. And talk a little bit about your sales channel. Which one has the greatest potential for growth?
Yeah, so that is a really great question. And I get that a lot because we talk so much about our pharmaceutical pedigree, how we're problem solving and clinically proven. But shifting that over to that direct to consumer sales channel, right? We want all of those things to instill trust in us and for people to understand that our products are high quality and problem solving. So our greatest opportunity for growth is in the direct to consumer space. And we're going to do that by taking that pharmaceutical pedigree, very, very effective products that are all clinically proven, and shifting that message into that direct to consumer sales channel so we can sell directly to all of those customers who have these problems, but are just looking for the best product to solve them.
Mm-hmm. Well, there are so many skincare product brands out there. So how does DermaDoctor distinguish itself from all the others?
Yeah, so it is what I mentioned sort of early on, and I try and convey this as much as possible. So, we're not cosmetic. We're not color. We're not perfume. You won't find any dyes or any fragrances in our products. Our products all created by a licensed dermatologist and really created to solve problems. So, if somebody's, looking for something that's purely cosmetic, we're not that brand. But if you're looking for serious skincare to really be problem solving, that's how DermaDoctor is differentiated in the marketplace.
Wonderful. What about any additional M&A opportunities?
So we are always looking for those M&A opportunities and something to bolt onto the side. So those are the conversations that I enjoy having the most because they're exciting. I love seeing what other innovations companies are doing and putting our operations together and, just selling more of those great products and, and in a more efficient way.
And try to get a few more questions in. Bess Adams wants to know, do you have a time frame to get to a positive earnings per share? And talk about what milestones have to happen for that to occur.
Yeah, so we continue down the same path that we're headed down now. So as I mentioned, the operational efficiencies, we are only 18 months in from the acquisition of DermaDoctor. So those operational efficiencies are still being realized. So able to optimize ad spend for all of the direct-to-consumer sales channels across our different business units. Meanwhile, having those opportunities for growth, growing into a new customer demographic, new geographies, and then also selling more of those products that we just recently launched.
Sure. Scott Barton wants to know, what percentages do you sell online versus retail? And what retail outlets are you currently in? And do you know how many of those customers are returning customers?
Yeah, so one thing that I absolutely love to tell people, I love this question. We are very blessed with a very loyal customer base, and that is on the DermaDoctor side and then also on the Avenova side. So we, what I do every week is I get, the whole company together for a brief meeting on Wednesday, and we go through our customer reviews, and we read them, and we read the good ones, and we read the bad ones. And of course, we have a ton of good ones, which really kind of like gets us going. I've tried every other product on the market. Yours has worked the best. Thank you so much. I wish that I had found this 20 years ago. I was like, well, we weren't around 20 years ago, but it's always nice to hear. So we do, in fact, have, I think, a very loyal customer base, across brands. And I think, that just comes from having these effective quality problem-solving products. People have a problem, it is solved by one of our products, and they trust us, and they keep coming back to us. And building on that customer base is super important to us, in addition to that growth that I just mentioned, but really keeping our customers happy and growing on that customer base. But our largest growth opportunities, because we are small, is teaching more people about Avenova, about the benefits of lid and lash hygiene. I think our largest hurdle there is just consumer education. It's that top of funnel advertising, getting people to realize, that they can, in fact, benefit from our product. And that, I think kind of goes across both Avenova and DermaDoctor in the direct-to-consumer sales channel, bringing in new customers and really having them learn that, we're top quality products that can really help them. That's our greatest growth opportunity right there.
Good. Well, Justin, thank you so much for your time. We have a lot more questions for you, but we are out of time. So we will send them to you. You can answer on your own, but please come back in the future with some more updates.
Absolutely. Would love to. Thanks for having me.
Thanks for joining us today. Good luck. Okay, everyone, stay with us. We'll be right back with our next presentation.